Hello and welcome to the College of Science, Health and Engineering. My name is Haidar Al-Ubaidi and I am the course coordinator of the Bachelor of Health Sciences course. This course opens the door to a career in health. It introduces you to the physical, social, as well as the environmental aspects of health and science. Learn about the role of health professionals and factors that influence health, both locally and globally. This flexible course gives you a broad understanding of the health sciences fields and lets you pursue up to two majors in specialized areas, including health and medical sciences, public health, health promotion, health and sustainability, rehabilitation counseling, as well as health, well-being, and performance. As a Bachelor of Health Science students, your semester will be made up of core subjects, majors, minors, as well as electives. The handbook will outline which are your core, major, minor subjects and where you can choose a set of recommended electives. There are many exciting opportunities to explore within the college and university, which will help to promote your development as a well-rounded professional and a global citizen. Welcome to La Trobe community. I wish you the very best in your academic journey.
Thanks for coming along. My name's Peter Higgs. I'm an Associate Professor in the Department of Public Health.
And I'm Dr. Sabrina Gupta in the same Department of Public Health.
We're going to be talking to you today about health promotion and the public health majors in the Bachelor of Health Sciences. When you think about public health, we work as trained specialists in a range of different spaces, and we have a mantra that says prevention is much better than cure. And our main focus is on changing the systems and the practices that shape the focus of communities and of nations, not just of individuals themselves. And there's a whole range of different programs that this might take place in, like clean water for communities or tobacco control and everything in between. So when we think about the reasons why you might want to do the majors of health promotion and public health, a number of the images here can give you a bit of insight. Obviously, at this stage in the world's environment, coronavirus has become a very important component of that. And to be honest, I've never heard the words public health mentioned so much in the mainstream media. But it is a lot more than just doing things like that. So as you can see, we've focused on campaigns around sexuality, racism, and tobacco control. The sorts of things that health promotion workers are very involved in, and I think it's clear to say that they're involved in action. It's more than just talking about doing things, that the sorts of activities that health promotion workers themselves do is to give communities control over what's actually going on. In terms of public health, as I'd mentioned earlier, it is about preventing disease, and it's thinking about the ways in which this might take place and giving communities their own informed choice to make those sorts of actions. As public health students or as health promotion students, we cater for a whole range of different spaces and topics, and if you can't find one on the dot points there, then I'd be very, very surprised. The sort of space that people who I've taught end up working in covers almost all of those different areas. There is a whole lot of other reasons why you might want to choose to study public health or the health promotion majors. And again, the slide itself gives some indication of that as to where we might want to go. In terms of what happens once you come onto campus, this is what your subject areas might look like, especially in second and first year. We have a core first year for most students who are doing the health sciences, but as you can see, your timetable is pretty full. We give people opportunities to study 4 subjects in each of the 2 semesters that we're running, and we're now looking at providing opportunities for people to take further study areas in an honours program and also in the Masters of Public Health. The opportunity to provide diversity is what we really strive for. Once you're actually on campus, the sorts of activities that you'll be doing are face-to-face. There's a lot of group work that is required. We enable people to practice, and we try to apply a whole range of frameworks that make people feel like they're actually pragmatically involved in things. It's more than just a theoretical degree. We put a lot of emphasis on people learning skills that they can apply in their workplaces. And importantly for us, working together with students as activists on campus is really a crucial part of the course as well. And there is a Public Health Students Association that a number of us academics have been actively supporting and involved with. They have a very active Facebook group, and I encourage you to get involved in them when you actually come onto campus, because having those sorts of extra opportunities, you get to meet a whole range of students who aren't just working in the same discipline that you are.
So in the third year, you will have an opportunity to engage in a professional setting and undertake a field placement. There's also opportunities to undertake an internship as well. There's lots of opportunities for overseas studies. We have various funding supports available for students. We've had students who've travelled to Mexico and undertaken the public health program in Mexico. We've had students go to Cambodia as well. And there's heaps of opportunities, and there's lots of academics who can support you for this. Students also gain credit for an elective. So if you undertake a placement overseas or take an overseas study opportunity, you may be able to get credit for an elective as well. Let's listen to Jeanette and Elizabeth for their experiences of what they've done after their degree.
There is so much scope that, where you start now doesn't necessarily mean that that's where you're going to spend the rest of your life.
Well, I actually did placement with the company that I'm working with at the moment, and I've been with them for 3 years. So being able to do placement throughout the course, I guess, really allows you to see how the skills you're learning could be taken into a real world setting, and how you would actually be working with clients, influencing clients, making real change, I guess, which is a key thing for us in health sciences.
Trobe provides a fantastic bedrock for your career, but also for engaging you with lifelong learning. Which is so important in working in a dynamic sector such as health.
I think La Trobe has played a huge part in where I am now, both from their industry reputation and the skills that I've learnt from working with the teachers and lecturers and the general course structure at La Trobe.
So here are some examples of job titles that you might see in public health and health promotion. For example, you've got community development worker, epidemiologist, which you may have heard on the news recently. We've got outreach worker, program manager, and if you do a search, for example, on a job-seeking website, we saw over 300 jobs that were advertised last week focusing on public health or where you could take your skills. Now, here are some places where our students are working at the moment. We've got students working at WIC Health, the Cancer Council, Diabetes Victoria. So there's a whole range of organisations that you could be working for, both at a local, national or at international level as well. So why choose public health or health promotion? It's because you can make the world a much better place. You can take a single or double majors, and there's a whole variety of ways of choosing your subjects. Our email addresses are there, and please feel free to contact us with any questions that you might have. Thanks so much for listening to our presentation. We look forward to your questions and answering those.
And hopefully we'll see you on campus soon.